Go.
Hi everyone. We we see in movies that vampires fear of garlic, and we know that they are acting, and that's not true. But I wanna ask you, do you believe that there are many people fear of garlic? Actually, we know that garlic has been used for medications and also has been used for flavors in the food. However, these people who fear of this these people who fear of the garlic, they avoid going to the restaurant which serve dishes garlic, and also they avoid eating other plants such as onion. So fear of garlic is called onion phobia. So today I will talk about onion phobia, and I will cover 3 main points, which are the causes and the symptoms and impacts, and the last main point is the treatment. So let's begin with the causes. Here I will talk about 3 causes. The first cause is traumatic experience, the second cause is genetics, and the last cause is smell and taste of the garlic. So let's begin with the first cause. Here what I mean by traumatic experience, that maybe this person who have this fear, there is a bad experience happened to him when he was a child. So this bad experience develops during his childhood. The second cause is genetics. What I mean by genetics is maybe this person who have this phobia, he was brought to it because some members of his family have it. And the last cause is smell and the taste of the garlic. We know that smell and the taste of garlic is very strong, and so the taste makes them feel anxious. Okay, I have talked about the causes of onion phobia. Now let's move on the symptoms and impacts. Here I will talk about first I will talk about the symptoms, and then I will talk about the impacts. There are two types of symptoms, like mental symptoms and physical symptoms. First, mental symptoms. They imagine bad images and bad movies of garlic, and also they have difficulty thinking about anything other than the fear. And also this fear, also they fear of losing control or going crazy. Now let's see what are the physical symptoms. The physical symptoms are feeling dizzy and troubled breathing, irregular heartbeat, and sweating. Also sweating and shaking. So these are the physical symptoms. Now let's see what are the impacts. These people who have this fear, they're scared of social interactions, and also they're scared of what people are thinking about them, and they avoid going to the restaurant because they they think that all restaurants serve serve garlic dishes. Okay, I have talked about the symptoms and impacts. Now let's see what the treatments of onion phobia are. Here I will talk about the medications, and also there are three types. There are three different types of medications, and they include the drugs. The first medication is beta blockers. Beta blockers are used to reduce the anxiety, and also it controls. Also, they control the physical symptoms like sweating, rapid heartbeat, and shaking hands. The second medication is antidepressants. Here there are three types of antidepressants, such as Paxil, Effexor, and Zolf. And these medications are used when these medications can be helpful when the feeling of the fear are strong. The last medication is benzodiazepines. This kind of medication are fast-acting anti-medications, and also they are used when the other medication don't work. So in conclusion, today I talked about onion phobia, and I covered three main points, which are the causes, the symptoms and impacts, and the last thing, the treatments. Actually, fear of garlic is not very common, and people who have this fear, and if these people who have this fear don't treat it, they will lose their job, they will lose their educations, they will lose their personal and business relations. Also, there is an interesting thing that some people don't know when this fear began, and they think that it began when Viper's movies started. So thank you for listening, and if you have any question,